All right, good afternoon, everyone. It is about 30 seconds to go before 3 o'clock, so we got a little excited about starting on time. But this is the Wednesday, August 7th meeting of the Housing and Economic Development Committee, which I'll call to order. It is now 3 o'clock, so any public comment, Taylor? No? Anybody wishing to speak on public comment or privilege of the floor? All right. There are no changes to the agenda. We do have the minutes from July 8th, which I will ask for someone to move. Moved by Mike, seconded by Travis. Any additions, subtractions, changes to those? All right, seeing none. All those in favor? All right, great. That passes unanimously. I do not have a chair's report today, so I will look to our county administrator. And the first item is a presentation for the 2025 project approval request, PAR, Housing and Economic Development Committee, ID 12486.
Thank you, Greg. So this project approval request form is just for the committee's awareness and discussion. This is broadband expansion to underserved or unserved areas, and this is a request that came from the Department of Planning and Sustainability. We have Nick here in chambers and Katie on the Zoom to speak to it if there are any questions. And just a caveat that this was put together, I want to say probably back in June, so there may be some, it's a little subject to change as this project has been subject to change.
Great, and just to clarify, the Connect All County Partnership Program doesn't allow for project management expenses to be covered by those funds, so that's what this is for.
That's correct.
And the project would last over 2 or so years, so that would be 2+ years of either a consultant or support, and for that purpose.
That's my understanding. Katie or Nick, if you have.
Sorry, Nick from the planning department, making his way to the table.
While Nick gets settled, I will just report to you that Nick, Bridget, and Lauren and I all sat down with the Connect All office after fielding a set of questions. They wanted written responses. We got those written responses back to them. We had a meeting with them on July 18th, and they were telling us to expect another round of written responses and questions, and then they hoped by the end of July or early August to start issuing awards. We still haven't heard anything after that meeting, but we did get a little bit more clarification on the issues at hand, and just want you all to be aware that when we do hear anything, assuming it's anything positive, we would bring any decision on accepting an award back to the legislature. And at that time, we would be requesting any funds that might be in this capital program. So in a way, the PAR form is a placeholder for what could be, because we don't know the conditions of the award, if we're going to get an award or the amount. So it's all a little fuzzy right now. But Nick, you chime in too, please.
Yeah, I think that I was just going to mention the fact that we have not yet gotten this grant, and that in the event we do, is we'll come back to the legislature for the acceptance of the grant, and at that point we should have a much clearer understanding of the matching costs we would be expected to come up with and the project management needs. I'll also say we've gotten some revised budget figures from ECC Technologies on this in the time since the PAR form was put together. Basically right now, we're looking at a cost that would be under 2% of the total project cost for project management. So that's where things stand today.
Great. And this, again, let me just pull up, this was for 150 miles of new fiber, is I think what it says in here, and 781 unserved addresses in the county.
That's correct.
Okay. Any questions for members of the committee for Nick, Katie, or Lisa?
What was that number, 1,000?
Sorry, it was 150 miles of new fiber and applications for pole attachment permits, et cetera, and 781 unserved addresses. Any other questions? Okay, thank you for the update. Next, we have report discussion, Bridge to Shelter Working Group recommendations, and that's ID 12636, and that starts on packet page 14, if you're following along. Lisa, or whomever?
I think it's going to be me. And if you give me just a minute, I will.
If there's other members of the working group here and you'd like to invite them to the table and then they can introduce themselves, that'd be great.
How did you know? I would love to do that. So we have Nels and Cindy and Liddy here in chambers, and Kit and Dina are joining us via Zoom.
Great.
From Kit Kephart and Dina Bodner from Department of Social Services.
And also in the working group from the city was City Manager Deb Molinoff and the Director of Planning, Lisa Nichols.
That's right.
Great.
But if you guys would like to introduce yourselves, please feel free. Nels?
Hi, I'm Nels Spohn. I'm the Director of Community Development for the Ithaca Urban Renewal Agency and a co-chair of the Continuum of Care.
Good afternoon. My name is Liddy Barger. I use she, her pronouns. I'm the Director of Housing Initiatives at Human Services Coalition.
Hi, Cindy Wilcox, she, her pronouns, Executive Director of the Human Services Coalition and co-chair of the COC. Hi, Bridget Nugent, Deputy County Administrator.
Great. And Kit, you're on Zoom?
Hi, Kit Kephart, Commissioner at the Department of Social Services.
And also Dina.
Dina Bodner, Deputy Commissioner at DSS.
Great. Well, Lisa, now that we know who's who, we'll turn it over to you.
Thanks, Greg, and happy to take it away, and very glad that our working group is so well represented here. So just to, as a reminder as to what brought us here, after discussions in this committee about the county's intention to construct an emergency shelter to meet the greater volume of unsheltered individuals and greater needs in the community, and understanding that that construction is, while it's being planned, it's going to take some time, the discussion turned to what can we be doing now to address the issue of unsheltered homelessness, and what is a wise investment of public dollars that will help to make an impact, and what would it cost the county to offer a lower barrier model of sheltering. So at the beginning of this process, we were referring to it as Code Blue 365, akin to running the Code Blue program 365 days per year. We've since renamed it the effort as a Bridge to Shelter, as we see it less of a continuation of Code Blue and more of a pilot program that can be implemented soon to get us to the construction of emergency shelter. So let me see. We've already met many of the folks on our working group. We had a small and nimble group of participants from county administration, Department of Social Services, the city, and the Human Services Coalition and Continuum of Care coordinator who helped draft this. We started meeting back in April, and we met every other week since then to get us to this point. And again, I want to express my thanks to Liddy for convening the group and synthesizing the feedback, sharing best practices, and compiling the draft proposal. And overall, it's just been very valuable to meet together so frequently on this topic. The charge of the Bridge to Shelter work group was to create an action plan, timeline, and budget to design and implement an interim mechanism to expand emergency shelter services, to provide low barrier access to emergency shelter stays for people who are living outdoors in unsheltered locations, and who are or will be impacted by encampment remediation efforts. Let's see, oops. Trigger fingers here. The assumptions, I also just wanted to state that the city has found it difficult in posting areas where people have been camping and they've been facing some issues on a weekly, if not a daily basis, and they currently do not have options to provide to people who are otherwise ineligible to be served in our traditional THA-funded shelter. And it's been helpful to talk through and understand the types of situations that people have been facing and to try to plan together to meet those needs and to ensure that the city and county's policies are in sync with one another and that the model we choose will actually have an impact in those cases. And then these are the assumptions that we made as we considered the options. That the goal is to reduce the number of people experiencing unsheltered homelessness, that this is an interim pilot project and is designed to be quickly employed or deployed, that this is going to be funded, need to be funded using local dollars, county dollars for operations, and that the recommendation is the result of a collaboration between the county, the city, and the continuum of care. Some of the definitions that are worth stating so that we have a shared understanding. What is an emergency shelter? It's a component, it's not the be-all and end-all, but it's a critical component of the homeless services system, allowing people experiencing homelessness to access immediate needs like sleep, food, medical care, and safety. It's one tool in the toolbox. It does not end homelessness on its own. And those shelters that are most effective are oriented toward attaining permanent housing. So they come with some level of case management that assists in that. The definition of unsheltered homelessness are people who are experiencing unsheltered homelessness have a primary nighttime residence that is not meant for human habitation, including living outdoors in tents, parks, or on the street, as well as people sleeping in cars, abandoned buildings, or on sidewalks. You can tell I use the Adobe versions and not the Canva version, so it's very particular on how I advance the pages. Here's a look at the scope of what we considered. And by the way, I emailed this to everyone on the committee if it's a little easier if you have your personal computer as well. But so the scope of how many people would this project serve? And Liddy and her team were able to pull data from HMIS and other sources and determine that if we aimed to serve 20 individuals at a time, we wouldn't meet the full need, but we'd be able to make a sizable impact, and it would not be an overload on the capacity of the system or too much for one provider to take on. There is an asterisk by the number, which I'll speak to in a minute, but all of our assumptions in the financial modeling are using 20 beds as the model. Who will the project serve? The target is people who are experiencing unsheltered homelessness and impacted by the city's encampment resolution policy. The staffing model includes 4 full-time equivalents, as well as funding for private security and regulatory considerations. We spent a lot of time talking about this piece. In the traditional THA, temporary housing assistance funded shelter that the county is used to operating. There are clearly defined parameters around health and safety, as well as policies and procedures. Those come from OTDA. Without those, the county would be left to start from scratch, and it's akin to a full legal review of every piece of the program, which we feel would be very time-consuming and pose some risk to the county to make sure that we're covering all the bases. Pretty late in our conversations, we learned that other counties who operate lower barrier shelters still require the shelter operator to apply to become OTDA certified, and we would recommend doing the same here so that those pieces are already covered, so that an operator would have that certification or operating certificate from OTDA, even though it would not be dependent on the funds from OTDA. So, and literally right up until the point that we submitted this presentation and put it on the agenda, we've been continuing to take in information and learn about lower barrier sheltering, and we've since learned that the OTDA certification requires certain staffing levels per individual served, and given the staffing model we've laid out here, according to those certification, we would be able to serve 15 to 18 people at a time in the shelter. So that was the reason for that asterisk by the 20 that's recommended. But at the staffing level provided, we could do 15 to 18. To do more than that would require more staffing and would increase the cost of the model. So this brings us to the summary of the recommended interim model that's in your packet, and we've broken it out into 2 slides to make it a little easier to see on the screens. So again, the number of clients served at a time, we had listed 20, it's closer to 18. Which the estimated number of clients served 60 to 85 or 60 to 80 per year, probably closer to 65. The referral pathway would be through the Continuum of Care coordinated entry. It would be considered an emergency shelter, and the eligible participants would be people experiencing unsheltered homelessness. The housing type, we would be considering a congregate or dorm style, and this is based on the cost, expediency, and availability of spaces locally. The length of time to shelter, we expect that people would be able to be served immediately through this model. The services provided would be housing and case management, referrals to services with a heavy emphasis on trying to find permanent supportive housing. And the staffing model, as we've mentioned, would be 4 full-time equivalents plus security. The contract for security and cleaning were included in the cost estimates, and as were expenses for food and other necessities. The length of time we'd expect people to be served in the program to be determined, but 90 days is the current average. And the service model would be considered a lower barrier overnight shelter with services. The short-term impact, we'd be looking for the reduction of unsheltered homelessness and offering 15 to 18 people access to shelter and other benefits. The cost estimated to provide a program of this size and scale is approximately $750,000 annually. The assumption is that it would be 100% locally funded, as our aim to serve individuals who have not been able to, our aim is to be able to serve people who have not been able to be served by the traditional THA shelter. If the shelter provider applied to be a Code Blue provider, we might expect that some of these costs could be reduced, or we could expect some level of reimbursement through the Code Blue program. The amount of reimbursement is in question because we know that New York State is changing its method of allocating Code Blue funding this year. Last year, we received a good number of funds for Code Blue, but it's our understanding that they're going to be dispersing those funds more widely across the state. So this, we hope, would be a higher end, but it's still a pilot.
Is that code for less money?
Yes.
Okay, sorry, just,
Yes. It's our understanding that Tompkins received the highest or among the highest allocations for Code Blue in the state. And so that might not happen again if they're trying to disperse the funds more widely across the counties. Kit may be able to speak to that. So some key considerations, as we discussed, as important considerations, but we have not fully resolved them, but we know that they will need to be discussed. The referral pathway, we're proposing and recommending a single referral pathway into the program, such as coordinated entry. It will be important to have a discharge policy that's clear and considers how to respond to program violations, such as unsafe behaviors. Security services would need to be included as a budget item to ensure the safety of guests, and we have factored it in here. It's really emphasized that the costs of adequate staffing and security should not be lowballed because it could lead to an unsafe environment for both guests and staff, making it a place where people are afraid to stay and where a provider won't be able to find the staff to work. Also having housing-focused case management by staff who are using trauma-informed, strength-based, and person-centered approaches are very important, with the goal of assisting people with permanent housing and other needed resources. And we also discussed some possible metrics to incorporate into the project, including length of stay, new and continuing, benefits obtained, housing at the exit, and et cetera, realizing that a primary outcome of the program is to provide shelter to individuals who are otherwise sleeping in unsheltered situations. Some of the anticipated challenges include the cost to implement this, as it would be 100% local share. The site location, we know that there are limitations in terms of sites available for this type of project locally. Also, workforce available to staff the shelter. We know this from current experience that this is difficult. The lack of available permanent housing is also a challenge, and it means the potential for longer shelter stays while waiting for housing slots to open up. And client safety and conduct due to the higher acuity of needs and potential for engaging in unsafe behaviors while in shelter. On the flip side, the opportunities with this project include increased collaboration, and we have just having been engaged in these past several months since April with this group has increased the meaningful collaboration between county and city staff and the continuum of care, and that would only continue. A pilot program can be used as an opportunity to learn what works and what doesn't, how to effectively reduce barriers to increase access to shelter, with an expectation that we will need to constantly monitor and adjust along the way, and these experiences will inform us how to scale up to meet the full need. And the program will provide first responders and outreach staff viable resources, and they currently have few options to provide when people are being relocated from outdoor locations. The group did consider other models, but determined not to recommend them, but they're worth mentioning what we did consider and kind of the path we took. We considered motel-based shelter. It comes at a higher cost. It offers private sleeping spaces and some on-staff support, but it comes at a higher cost, a reliance on motels, and they're subject to operator availability, which isn't guaranteed, and they are somewhat removed from available services. We also considered a transitional housing model, which the pros of this model is that we could skip the emergency shelter stay altogether and place people right away into a longer-term supportive apartment environment. If we had a greater volume of housing, this would be a fantastic option, but it's not exactly the case, so it would not meet the immediate needs for shelter. It would lend itself to increased stability in a longer-term setting, lower density, scattered site apartments, and intensive case management. But because of the low inventory of units available, there's anticipated to be slower turnover of those opportunities. But this is certainly an area within the housing pipeline that would have a positive impact. And we spent a lot of time considering that model. And the third is a resource hub model. There is a need for a centralized location for people to access services, basic needs for shower, laundry, et cetera, as well as a one-stop hub for providers to be able to meet with people. But that type of model does not include overnight shelter. So this is a little more detail on the transitional housing model and the cost that would support 20 participants. It's comparable to the cost of the emergency shelter model that we're considering and recommending. And it's, I think, useful to say this model is currently being rolled out this year with grant funds between Whole Health and Catholic Charities, and I think it would be worth to closely watch the rollout and impacts that this program is able to achieve, and if possible in the future consider expanding it if it is meeting the making an impact, because it is another piece in the puzzle or in the pipeline that is needed. And if we had the funding, we would say it would be worth investing in both places. But since we're looking at the emergency shelter need, that's what we focused on. So really the next steps in the process, we're sharing this proposal with you today, wanting to hear your feedback and questions so we can incorporate it. We would then consider moving it forward for consideration as an over-target request in the 2025 DSS budget. In addition to the costs outlined in the RFP, there is an additional need for an additional staff person at DSS for shelter administration, for not only for development of the low barrier model, but oversight and implementation of our current providers, which has just increased in time over the last several years, those needs. And then if this proposal were considered and decided to move forward for 2025, there would be work required to develop an RFP for a lower barrier shelter provider to be issued for implementation in 2025. So that's kind of what the next steps would look like. So, and that is it. This is the last page about other resources about emergency shelter are available, and I think provide some of the backup and the basis for the recommendations in the report that Liddy has compiled here. And
those are also hyperlinked for anybody in the report.
Yep. So, and I just shared it, that with all of you, so you have the access to those links. So I can stop sharing unless there's any slide you'd like me to go back to while I have it up.
Open it up to members of the committee for questions, comments. Veronica and then Mike.
Thank you, Lisa, and everyone for doing this work and bringing this. I have two questions. One is, what physical spaces for this are potentially possibilities? Or what, because that can you speak more to that challenge maybe? And also, are you envisioning a place where people staying there overnight would be able to be there 24/7 or something else than that?
So in this model, we would be issuing the RFP for a shelter provider who would be looking for and coming up with the space to meet the need based on what's available locally. And the housing, I don't believe the staffing model incorporated 24/7. It's simply overnight, so it's.
So does that mean, like, if someone's staying there, they'll be like kicked out during the day and allowed to return after a certain hour?
That's more or less, yes. What we would be hoping is that as this is developed and comes online, there will be other services and supports also coming online, such as the Friendship Center or Resource Hub that comes out of that. And again, being that this is 100% funded locally, we are trying to do our best to incorporate whatever best practices we could find while knowing that we needed to try to make the wisest investment with scarce resources. So that's where that calculus came in.
Could I just add to that? The city manager is part of the group and has talked about bringing to the council a proposal to help develop a hub concept for daytime use. That's still in the very early stages, but I think that's something that the city has some budget funding authority for, as in terms that they haven't utilized for responding to encampments. And one potential use is to help facilitate startup of a hub, a daytime resource hub.
That would be awesome. And I think it would also be really important to have like daytime space and overnight space as close together as humanly possible. And it sounds like different entities will be making the decisions on those potentially, depending where we go. I just want to state that now, so that's like kept in mind through the whole process.
Thank you. Mike?
My question was similar to Veronica's, but I also wondered, I guess, how is this different than what we have in place now? Like with St. John's?
So Kit, would you like to field that question?
Sure. So I think our challenge right now is that for many of the people that are, the majority of the people that are living in an encampment or living on the streets are really not engaging. They're not willing to engage with social services, so they're not willing to come in, meet with us and apply for services. So I think this is really targeting a population and making a shelter option available for people that otherwise are staying in those living rough environments, as opposed to having to go through the formal process of seeking shelter services through social services.
I would also state that many of those individuals are may have a sanction for a variety of reasons for receiving THA funding, so they're not eligible, or if, for instance, they have engaged but are not able for whatever reason to continue with substance abuse treatment and so forth, they may no longer qualify or may be unsanctioned for a period of time. So there are reasons why they are not able to engage with the traditional shelter.
THA is temporary housing assistance.
Other questions?
Kind of is the same question though. Like, if somebody wanted shelter, they would probably go to St. John's, I would think. What would make this new shelter more attractive to that person? I guess that's where I'm getting a little muddled. It's,
So if you look at the demand or the use of shelter during the Code Blue, when there are no restrictions, the use of shelter increases. I mean, it's also during the colder weather months, but when someone is, the barriers are removed from having to apply and go through the, whatever types of requirements that are needed to engage with temporary housing assistance, people seek shelter that way. So this is essentially trying to provide that same style of lower barrier, at least to help get people sheltered and engage. And then, perhaps down the line, we've seen with other low barrier shelters in other areas of the state, some do eventually qualify to receive that THA funding. Whether or not we would choose to design it that way remains to be seen, but that is one way to do it. This is just for expedience sake to get people in and sheltered in the lowest barrier approach.
one more?
Sure.
So when we say lower barrier, you walk in and you're mentally compromised, let's say, because you're drunk, let's say. You walk in, we're going to take you in, but you're obviously not allowed to drink at the shelter, I would think. I mean, so is that what we mean by low barrier? Like just anybody can walk in off the street, but you can only stay one night, right? Or are we making this a longer, I mean, that's my understanding, it's just a one night kind of deal, or?
We would need to develop, protocols and timelines. I think it would be longer than one night.
Okay.
But yeah, and if people are, have been using substances or mentally compromised, as you said, they would, so long as they can not pose a danger to themselves or others in the shelter, they could stay there. I think it's when the behaviors pose a danger to others is where people tend to draw the line in these types of programs.
So can I, go ahead. I'll let you know. You go first. Go ahead, please.
This was on this topic. Correct me if I'm wrong, but I think I heard Lisa carefully correct herself from saying low barrier to lower barrier. And my understanding of the significance, but I'd like someone to tell me if this is accurate, is that currently there are many barriers to shelter. This proposal would remove one barrier, namely the need to apply for and receive funding through DSS. I don't know if it's all THA funding or it could be other things too, but does not necessarily remove other barriers that exist right now. Is that right?
I think that's true. I mean, there are many other considerations and particularities that we had conversations about, but we were trying to really get to the high level cost estimate, and those types of things like allowing for pets, allowing for any number of contingencies. We weren't able to cross all of those all of those out just yet.
So on this topic, currently in the shelter system, if someone comes in and is actively using a substance, they would have to sign up or agree to a treatment plan, or working through that substance use issue. And so in this setting, they could come with that same substance use issue and just have shelter.
That's true. I think that and there's a term for it, and team, feel free to jump in, but they, in our shelter as it's currently run and through the THA program, you have to engage with CSAC, clinical alcohol substance abuse treatment provider. And if you are not engaging, then that could subject you to sanction.
And so someone who may have gone to what we're calling a traditional shelter, which I never like the term traditional, but an OTDA style shelter, who may not have been able to complete or fulfill their obligations, could then be sanctioned for a period of time, precluding them from accessing that type of shelter during their sanction period. But this shelter would allow for that person to receive shelter.
That's correct.
Okay. Pardon? If they were
If they met, so I think it's important, because just to remember the eligible criteria for this pilot. So this pilot isn't proposing a low barrier all the time for everybody model. So a person who had become sanctioned from THA shelter and met the criteria of living outdoors and being impacted by the encampment resolution policy would become eligible for entry into the lower barrier shelter.
Got it.
But not every single person who isn't eligible for THA shelter is necessarily eligible for the pilot. Does that make sense?
Yes.
Yes.
Before I let Ann ask her question, I would also ask the experts in the room, if there's something we're saying that's not the right vernacular, call us out, please, so we can get this right, because there's a lot of acronyms, there's a lot of terminology that we may not just be aware of. So if we're saying something that's incorrect or off base, just speak out and say, well, let's stop for a second and we'll have a quick little lesson. So Ann?
Thank you. Just one thing I wanted to say first was I had a brother who had periods of homelessness in his life, and having a lower barrier place was the only type of place that he would go. Otherwise, he would live on the streets or find some probably not safe place to be. And it wasn't till at one point that he gained, the providers gained his trust, that he went into a situation where he was able to get real housing, and that wasn't actually till the later part of his life. So he throughout his life he had fear and mistrust, various issues. So I totally get where the next level, it sounds like we're going to, with the lower barrier. And so I'm really wanted to thank you for all the work that's been done on this. And I know there's more work to do. And some of the things that are popping out to me some of them have been mentioned, like what about how long can they be there? Can they leave their belongings there? I know that's some of the stuff we have to figure out. The pets, the amount of time they can be there. And so I want to say too that I totally support this, and let us know how we can help going forward. Thank you. So no real question, I guess.
Travis, do you have anything to add or comment? Okay. The only question I have really is timeline. and just trying to get some more clarity on that. If this is included as an OTR in the budget process, we can say that, let's just go with the assumption that this would get passed as an OTR. We'll play that one, because that's really the one that impacts the timeline. So November, right? And then we would have an RFP ready to go as of November approval of the budget, and then there'd be 30 to 45 days to respond, 60 days to respond, right?
That's a very optimistic timeline. That would require our group to continue meeting every 2 weeks to assume that this will be funded through the budget process and start developing the RFP. This has been very high level. We have not pulled in anything from
the RFP components.
The RFP components, any of the legal components, et cetera, so.
Okay, so let's go back to approves in the budget in November.
Yeah.
Then it's 120 days, 4 months to get to an RFP from there. So we're at March, and then it's 60 days to respond to the RFP or so, or 45 days?
30, I think.
30? Okay, so we're at April, and then there's got to be a review and an acceptance of the RFP, which probably has some sort of approval, or is that approval done at a staff level?
It's typically done at a staff level, but it would come through committee for.
Okay, so then we're somewhere in May, June. And then, yeah, I guess I'm struggling to see when this happens in 2025, realizing that there's not a vacant space for 18 people to be housed in a what's the word?
Congregate.
Congregate, thank you. Congregate setting, sort of readily available. There's not like community organizations that are just chomping at the bit for RFPs like this. So when does this actually impact the community? Is it really 2026? Is it the end of 2025? We're into Code Blue already. I just struggle to see when this actually makes an impact.
I would say the earliest would be mid-2025.
Yeah. Okay. Is this something, I don't know you, sorry, I don't want to, I'm assuming that someone in your position would hate a question like this from someone in my position. Is this something that we could potentially pull out of the budget process, because it has been an immediate need and it's something that has gone unaddressed for several years? And is there a way to have this conversation outside of that process?
Well, given the cost of it, it would have an impact on the budget for sure. If it were to be included in the budget target, it would, and then that would require, it would require the legislature's consensus to do that and to put this above everything else in the budget process. Typically, when there are competing items for consideration, it's best to do that all at once in the budget process. If this is deemed to be an immediate community need, then that requires action outside the budget process, we could approach it as such.
Okay. So I guess that's up to us and our other 11 colleagues that are, or 9 colleagues that aren't here today, to try to figure that out in some way. Okay. Go ahead, Ann.
Question?
Yeah.
Just thinking of, Nels, you mentioned about the city thinking about doing some type of hub. Is that correct?
The city manager is interested in exploring that option, yes.
Interesting. Just thinking as if that could be explored, is there some way that could be integrated right on site, that same site? So just.
Lisa?
To that point, there are a number of RFPs that are out currently that impact this or directly related, one of which is the RFP for the THA shelter operation, as well as Code Blue for the coming year. But in that, the first RFP is the operation of the Friendship Center, which is essentially funding for a resource hub. Right. It does not, the operator of the shelter does not have to be the same operator of the Friendship Center. So that is out for bid right now, and organizations that are interested are in the midst of applying for that. So it's something that's in process.
So what do you need from us next?
Well, this was really just to make you aware of what the best thinking of the group, what we came to, the recommendation, the scope of the project, and the cost, to see if you had questions, concerns, anything you would like to see different in this model. But otherwise, this is the plan for the next step is to include this as an over-target request in the 2025 budget process under Department of Social Services.
And it would be a 3-year OTR? Or?
Probably.
Okay. If we're bridging to shelter, that would sort of align with our timeline?
Yeah, and it's designed to, I mean, the other reason we chose a congregate model, which is not really the best practice gold standard, but it is expedient. And it can be stood up in areas where there are, we don't have 18 separate rooms, which would be preferable for people. But if we had an expanse where we could make it work elsewhere, that's why we chose this.
Great. Well, I really appreciate everybody's efforts and involvement. It seems like a real coming together of all the parties, so thank you. And I'll make sure that we share this with the rest of the legislature so they can get a peek, and share the link to the conversation today. So thank you all for taking a stride to hopefully impact this challenge we have in our community.
Thanks for the opportunity.
Thank you. Lisa, anything else in the county administrator's report?
I think that's it for me. Thanks.
All right. Thank you. All right. Next, we have our workforce development. Chris, if you want to make your way up, we have a resolution on the table for you.
Thank you. How's everyone doing?
Good. How are you? Good.
Late night for y'all last night, though.
Oh, yeah. That's just part of the job. The resolution we have is the authorization to increase hours to workforce development, career center positions, Tompkins County Workforce Development, ID 12626. Could I have someone move that, please? Moved by Ann, seconded by Veronica. Chris, I'll turn it over to you to kind of walk us through that resolution and see if there's any questions from members of the committee.
Yeah, so as you know, on October 3rd, 2023, we restructured, so the Office of Employment Training and the Workforce Development Board merged into one department. So since then, we've been going through a change in management, change in operations, change in finances, changing in how we do our business. And along the way, I've found that on the service provider side, at our Career Center, we're definitely short-staffed. We have some employees that currently are working 35 hours per week, and it would be beneficial to the department if they can get up 5 more hours per week. One's on our adult team, and then the other's on our youth team. So we basically, with all the vacancies that we had earlier in the year and then planning towards next year's budget, we have like the money to fund this position and everything. But going forward as a new department, we definitely feel that these positions should be 40 hours. A lot of our staff is overworked right now. On our youth side, we have 2 youth staff right now, and we have about 50 youth on our caseload. And then if you read the Tompkins Weekly, we have our summer youth employment program going on right now. And for our staff, that's around 50 extra kids that they're focusing on too. So this takes away time for proper documentation. If we don't have proper documentation, the state audits us, and then that's a finding, and then we have the risk of losing money. And as you know, we don't get a lot of money in the first place, so we need to take care of, be stewards of the money that we have and make sure we keep that money. Along with that, that's, with less people, that's less outreach that we can do in the community. That's less following up with people. On our adult side, we have about 60 active people on our caseload. So again, that's following up with them. There are 60 people in active training, and then we also have like a wait list actually. So since I've been here, we've seen the wait list be at about 30 people. So that means if you come to the Career Center, you're seeking help from us for training and career exploration. You're stuck waiting. So it's not at 30 right now. It's probably about around 8-ish right now, but that wait means 6 to 8 weeks actually. So, I mean, in the meantime, we can give them like some sort of help, like, help them finding jobs and things like little things. And that's part of why we're working so hard to build up our website too, to like create the jobs board, to create the newsletter, to create these different things where people can access us when we're not available. But just those 5 hours will make a difference for each of those employees, but then that's really not the end of it. Either the restructure is gonna be a great idea or a disaster. And we're really just walking through this process right now. So this is a first step, but we also do need another employee at the Career Center, because usually, right now we have 6 service providers out there, and usually, historically there's been at least 7, but right now we just have 6, and they're all working very hard, working extra hours and everything. So this year we're also going to have an OTR for an extra person at the Career Center to help us fulfill our duties as a department. And looking at the strategic priorities and objectives, the strategic plan with the county, this plays into equitable service delivery. So one of them is bringing services and outreach to communities outside of downtown Ithaca. Like I said, we want to go outside of Ithaca. Prioritize hiring individuals with lived experience in underserved communities. So again, that's a big challenge. Like people that come here, sometimes they're with us for a month, or they're with us for 12 months, or they disappear and come back. There's a lot of extra time that needs to go into these participants just because of the background, the experiences that they're coming from. And that's who we serve as a department too, is giving opportunity to people who deserve it. And we can't do that if we're short-staffed and people are burnt out. And looking back, that has been an issue of the departments. Like with OET and then WDB at the director level and lower, there's high turnover since pre-COVID. So right now we're getting into the place where we don't have that high turnover. And this resolution helps us get to the next step. I won't get into the 3 other priorities and objectives. I can save that for the OTR. But yeah, that's the rundown of this resolution.
Great. Questions from members of the committee? Okay. Does this have, if this passes in this year, does this have a budget implication for next year?
Oh, we have the funds to cover it next year, and we've been moving money around in our budget to figure out how to do that, and so yeah, we do have like money to sustain it.
So this would be cost neutral this year and in 2025?
Yeah, we'll be good. We talked with Norma and everybody, and okay. I've talked with the board and our deputy director Diane and everything, and yeah.
Yeah, again, and I'm trying to make sure we're asking all the questions before we move it through. Go ahead, Ann.
I'm sure you've already figured this out, but just to say it out loud here at this committee, are the folks that are in these positions okay with going from 35 to 40 hours?
Oh yeah, absolutely. They can't wait, because that means they can do more work and help people more. So yeah, they're definitely, I haven't really like given them like the final word on anything yet, but we've discussed it, you know, through one-on-ones and stuff like that, and they definitely want to be able to give more time to our community.
Well, thank them for us, because I know, like you said, they're overworked and they're doing really important work in the community.
Yeah.
So thank you.
Thank you.
Okay, if there's no other questions from members of the committee, we'll go ahead and take a vote. All those in favor? All right, that passes unanimously. Thanks, Chris. And again, I'll echo Ann's comments. Thanks to those that continue to do this work. It's important that we have people getting good jobs and trying to navigate their careers, and you and your team are doing that every day. So thank you on behalf of the community.
All right, thank you for your time, everyone.
Thanks, Chris. All right, next we have the Planning and Sustainability Department. I see Megan is here for a commissioner's report.
Yep, if you don't mind inserting deputy there. Katie had to run to another meeting, so apologizes to skip out. But you heard from her on the broadband front, so I'll just cover a few housing things very quickly. One is an opportunity, thanks to the Enterprise Community Partners and the City of Ithaca's invitation to me. The Enterprise Community Partners are working with NYU's Furman Center on a peer learning network in New York State, bringing together 8 to 10 municipalities focused on smaller mid-sized cities, like 50 to 100,000 people. And they had directly reached out to our community, hoping that we would have an application. Counties weren't eligible, so the city was. They applied, and the mayor, Nels Bowen from the IURA, are making the core of the city's team, and they've asked Kate De La Garza from INHS and myself to join. And so that'll be an opportunity to, work with other municipalities and the resources that Enterprise and the Furman Center are bringing in to hopefully help us look at other tools and other learning and things that we can do to help address the housing challenges that unfortunately many of our communities across the state are facing. So I'll certainly bring anything I learned back to you all. And it seems like it's a good mesh with work we had on our work program too. So we always appreciate additional brains and the effort. Next up on the Community Housing Development Fund front, we are going to be meeting with the Program Oversight Committee in August to discuss allocating some additional IDA funds that have come in through their workforce housing policy. So we recently received $385,000 for the Breeze project, and we're anticipating approximately another $167,000 coming in soon, which is very much needed. And we've also been looking at the pipeline of projects, and so it's looking like we have likely 2 9% low-income housing tax credit projects going in the cycle this year. We probably have 2 more for next year and at least 1 more for 2026. Historically, we've only ever gotten an allocation of 1 tax credit award a year. So I'm hoping that we can maybe bend some of the Homes and Community Renewal staff ears when they come for the ribbon cutting for the conference center in Asteri, and continue to plead our case for, not just geographically spreading everything out, but that we've got some really good opportunities, and to maybe consider 2 projects in a year would be fantastic, because otherwise we're looking at probably doubling the timeline it takes to bring those projects online. And then finally, with our CDBG rehab program, it has unfortunately been stalled while we've been waiting for a critical state form to be finalized. No one in the state could move forward with their programs. That happened just the other day, and so INHS, our subrecipient, has lots of projects lined up, so we are getting cracking on that. And we also had the opportunity to talk with a peer up in the Adirondacks that were able to attach some permanent affordability, which has been a long time dream of mine with CDBG. They did it with 1 house. So we talked with them, how they made that happen, and we're looking at some options that we might be able to incorporate into our CDBG rehab program, so that we're not only helping the initial family that's already in the house, but that we can be helping all the successive owners of that house going forward.
Sounds like a lot of exciting stuff. That's great. Thank you. Questions or comments from members of the committee? Yeah, Ann?
So you're saying permanent, like permanently affordable, like forever?
Having an option for really major rehab where you're putting, not just kind of a few $1,000s, but, really increasing the value of the house, to have an option for it to opt into the community housing trust. That would provide an immediate benefit potentially to the homeowner, because if we're making significant improvements, that is going to impact their taxes, and we don't have a legal mechanism to reduce those tax impacts unless it is in a housing trust. And the benefit for successive buyers would be if, say, you've taken a house that had a lot of issues, you renovate it, and in our market, that house is now worth $400,000, $500,000. We know that, the next home buyers will, not be most likely lower to moderate income households at that price point. But if the house is in the community housing trust, then that helps with the kind of the appreciation and how much equity sellers take out of the house so that we can keep it permanently affordable along the model that INHS has been using and Habitat for Humanity as well in their for sale projects.
Great, thank you.
Any other questions? All right, well, thanks, Megan. All right, next on deck, we've got Nick from the Department of Planning and Sustainability to give us a tourism quarterly update for August. It's ID 12625. Nick, I'll turn it over to you.
Thanks. So in your packet, there's a memo describing second quarter 2024 updates, primarily the room tax collections for the quarter came in at $1,113,782. It's an increase from second quarter of 2023, and it's in line with what we had budgeted for this year. That's encouraging. There's a few other updates about STPB, the Strategic Tourism Planning Board, and the meetings they've held this quarter. Noteworthy among that is the visitor profile study that we've gotten some preliminary data back on. Expect by next month we'll have a second quarter of data to share with the group as well. So that's coming together nicely. A few other updates there are relating to some state legislation and the opening of the downtown conference center. One other note is that we are currently accepting grant applications for the Community Celebrations Grant, Tourism Advancement Grant, and Tourism Capital Grant. We had a workshop on the 1st, which was last week, Thursday. About a dozen folks in attendance and lots of good conversation about projects and ideas that they're working on. And the rest of the memo just describes the various awards that have been issued in the last year and events that are coming up. Happy to answer any questions that folks have.
I'll give folks a chance to digest some of that. The things I thought were interesting in the memo, one, it's great to see that room tax collection is up. We're not getting as favorable news from some of our tax collections, like sales tax, so this was nice to see. The other thing, the State Assembly and Senate bill that would change essentially for short-term rentals to be required to comply with sales tax, which could be a big bump and was probably a point of contention for our traditional hotel operators and not being on a level playing field with short-term rental operators. So that's good to see. The fall tourism grant cycle, I just think it's important that we point out that all those applications are due by August 26th. Sorry, your memo is really interesting to me. The tourism sector continues to operate with a workforce that is smaller than it was prior to the pandemic. Data from the Bureau of Labor Statistics indicates that as of April, the leisure and hospitality sector in the county employs approximately 900 fewer jobs than it did in April 2019.
Yeah, this has been somewhat consistent over the last few years as we've looked back to pre-COVID employment data at the county level. That roughly between 80 or so percent of the workforce as compared to what it was. So, yeah.
So definitely has an impact. I think some of that probably too is the industry maybe adjusting service delivery models and things like that to adjust for our current conditions. But it goes to show that if we have that many fewer jobs, how it seems like a sizable sector of employment in our community. But I know that is a consistent number over several years. So questions from members of the committee for Nick on the tourism report? Ann?
I see that this is the first period where lodging establishments could file and pay their room occupancy tax online. How many, or do you get a sense of how many are doing that, or?
Yeah, I don't have the exact numbers at my fingertips. I talked to Lisa in Treasury about it after the filing deadline, and it sounded like several, maybe half or so of the establishments were able to pay online, and several still filed their returns by mail and paper. So it's still a transition in progress. But yeah, we are accepting payment online for that tax right now. So
great.
Mm-hmm. Great. All right. Well, if no other questions, we'll move on to the resolution that we have, which is the designation of tourism promotion agency for the state of New York. That's doc ID 12579. Look for someone to move that. Moved by Travis, seconded by Annie. Nick, I'll turn this over to you to give a brief explanation.
Sure, thanks. So every year we bring forward a resolution to designate a organization as a tourism promotion agency for Tompkins County. That's the TPA. This designation allows the agency that's named to utilize the I Love New York funding program, the matching funds program. Peggy Coleman, who's here, can speak more to that detail, but the county has to take some sort of action to confirm that designation, and this resolution does that. So we talked about it at the last STPB meeting in July, and bringing it forward here for consideration today.
Great. I just want to thank Peggy for being here. If there's any questions by members of the committee, again, Peggy Coleman with the Chamber and CVB Visit Ithaca. Any questions by members of the committee? This is a standard resolution that we go through, and this was supported unanimously at the STPB. All right, so seeing no questions, all those in favor? Okay, that passes unanimously.
Great, thank you.
Thank you, and Peggy, thanks again for your work on behalf of the county, and look forward to another fruitful year of destination marketing and attraction of a lot of group business. Thanks. Of course. All right. It looks like we are making good progress, and we are at number 10 on the agenda, Ithaca Area Economic Development. We have a report and discussion for the August IAED, and that's ID number 12634. I'll ask Heather and team to make their way to the table. So I think we have two items on the agenda for you all. We have a direct to work and Tompkins Build program report, but we have it listed first for a quick IAED update.
You have your update in the packet. I'm happy to take questions. Couple of highlights. We've been busy this summer with consultants. The consultants doing the Countywide Economic Development Strategy. We're here planning to be back in September. Did some preliminary meetings, some data analysis, and we're setting up for focus groups and a community pulse survey that will be distributed throughout the community in the end of September. The Newmark group was in the Southern Tier 2 weeks ago, and they're doing the regional Southern Tier Clean Tech study, and they spent a significant amount of time in Ithaca meeting with startups and more established companies, looking at some of our available buildings and sites to grow companies and attract new industry in that clean tech sector into our community. We also participated in a number of focus group meetings, workforce development, some state legislative officials, NYSEG, local utility and service providers. So all in all, I think it was a really good visit by Newmark's, both their site selection and their economic development teams were here for about 4 days. And at the IDA, they continue to look at Southworks, our $585 million adaptive reuse, mixed-use project. And all of those project documents are up on the IDA's website if anyone's really interested in seeing their proposal, their recommendations, and some of the work around that project. And I'm happy to take questions.
Questions from members of the committee for the Ithaca Area Economic Development Report? Okay. Well, as always, thank you for the thorough memo and update. And I guess we'll now have more time for an update from Danny for the Direct to Work and Tompkins Build program.
I don't know if you want that. You know I like to talk, so we'll try to.
This is a topic we like talking about. So you're in good company.
We'll cap you at 5 o'clock.
Well,
or
everyone's sake.
Before. Just because you can doesn't mean you should.
I hear that loud and clear. No, I'm really excited to be back. I have not had a chance to give any updates since I think last November when I came in with Chris from Tompkins Workforce Development for the OTR. So, technology, please work for me. Here we go. So for some of those that have not been close to the workforce efforts of IAED for the last 2.5 years, I like to just kind of start with this big picture overview. I won't spend too much time on this slide, but if you are close to it, you'll notice the first thing, we have new logos. So we grew up a little bit, and we thought it would be important to actually have official logos as we start marketing and branding. And we have picked up momentum in the community, so creating better visibility. So once again, on the left side, it is our focus to build industry partnerships, which means that they are industry driven by our targeted industries within the county, and over time we then find ways to embed them within our community partners and build capacity within those community partners and sustain that. So very often we just call Direct to Work as our manufacturing industry partnership that currently serves 8 manufacturers in Tompkins County. We're looking to expand that by 2 more manufacturers by the end of this year. And we're kind of courting a couple of them right now to make sure they align to our employer profile. And later on, we'll talk about a little bit more of our Tompkins Build Industry Partnership, which is our construction trades IP that we're working on. So within the industry partnership model, that framework, there is a strategic recruitment, there is a assessment process, there's a referral, a prepared, a place, and support component. And in terms of that model, we are actually in lockstep with Tompkins County Workforce Development. Our recruitment, our assessment, and referral process has officially been embedded into the Career Center, which we'll talk a little bit more with our new workforce partner, our program manager on. We're really starting to pick up momentum there around the info sessions, and over the last 6 months, we've done train the trainer sessions with all of Chris's staff as well as the Department of Labor staff as they serve everyone that's un and underemployed. We thought it was really important that they fully understood what the model was and kind of what we were working with. We also worked with Chris to get on the eligible training provider list, which allows individuals to go through the Career Center for WIOA funding to help support them to go through the program. So within that, individuals will go through a registration process between IAED and the Career Center, which is about a 2-week process, but a week and a half for the Career Center.
Danny, can I just interrupt?
Yep.
OEO funding, can you just see what
sorry, I'm so bad with that. So that's the Workforce Innovation Opportunity Act. That is the federal funding that the Workforce Development Board gets, and then they allocate that to the Career Center, and then they disperse that between dislocated workers, adult workers, and then youth funding as well.
Thank you.
Yep. So within those frameworks, we now have pathways to manufacturing as well as pathways to apprenticeship, which we'll talk about a little bit later, but those are the prepared components. And why it's considered inclusive career pathways is that there's 3 ways that we will always try to meet people where they are. Those that are not ready just yet, and figuring out how we create a remediation plan for them to go back into the community to work with our appropriate community partners, whether it's an academic or non-academic barrier. The second is the prepared component, which is the Pathways to Manufacturing program. In this case, a full-time career readiness program that runs Monday through Friday from 9:30 to 3:30. And the third is that those that already have prior experience but may have challenges to actually get an interview, how do we do direct referrals to one of our manufacturers that are within those within our industry partnership? So that's why it's considered Pathways. It's not a one-all apply-all solution that everyone has to go through the program, but we do try to meet people where they are. So some updates since I've been here from 2023 to 2024 is first, Mary Helen Bavis came on board in January and has hit the ground running. I think within the first 3 months of her being on the team, she met with over 50 community partners and has taken a bigger focus on how do we get outside of the city of Ithaca and create better visibility among our rural communities, starting to work with the school districts, specifically the town and village clerks, to do promotion, and also doing info sessions publicly within all of the libraries. So she has been a blessing and has really helped with the visibility in our program. She's also working very closely with Chris's staff on the marketing and communication side with their new staff, as well as continuously following up with referrals for people that don't get accepted into our program. The second update, and is probably the most exciting update for me, within the initiative or the industry partnership framework, it's crucial to find the right educational partner to embed the work in. IAED does not provide any direct services to job seekers. So as I mentioned, over time, we build capacity within the community and we build capacity within our partners. And over the last few months, we have been partnering with Tompkins Cortland Community College and exploring how we could actually embed ourselves within their workforce department and how do we kind of create these pathways that continue on to their micro-credentials that they already offer in advanced manufacturing. So in June, we got the official notice that we have been approved by SUNY to be a pre-apprenticeship readiness program. And this is absolutely incredible for us. IAED will always lend technical assistance around the recruitment, assessment, and referral process. We will always be the matchmaker on the back end for employer engagement. But to now embed this in TC3, it allows us to do many more program enhancements and provide additional credentialing and hands-on experience that our employers have given feedback on. So since our relationship with TC3, I've built out 24 hours of metrology hands-on practice, which was piloted in our spring cohort, and it's being done right now in our summer cohort, where we have an in-person instructor that's coming in to do blueprint reading, drawing, having them focus with dial calipers and micrometers. We are currently working on building out a 12-hour soldering component that will launch this fall in that cohort, where not only individuals will learn how to solder a circuit board that will be battery operated, but they'll also how to desolder it. We wanted to come up with a project that was a takeaway for them, that these individuals could take something home that was tangible to show what they were building in the program. We've also incorporated OSHA 10, and the other perks or incentives that to date we've only been able to offer a $500 stipend, but now being a SUNY pre-apprenticeship, we can add an additional $500. So individuals actually get a $1,000 stipend to do the program. And we now can offer a $500 employer incentive for any employer in our industry partnership that hires anyone for a full-time position, which is really exciting. Because of all these program enhancements, we have expanded the program to a 5-week full-time program due to just needing the additional hours and time, but it seems to be working out really well. The summer cohort that's currently running right now is the first program that we're launching the 5 weeks for.
Can I ask a quick question?
Yeah.
Where does this money for the stipend and the employer incentive come from?
SUNY. SUNY, yeah. So SUNY has been trying to push out pre-apprenticeship readiness programs in multiple sectors, and this funding is good through 2027. So that was pretty exciting to figure out how can we still partner with Tompkins County Workforce Development on what we've covered under that tuition, which is the Tooling U and our non-technical instruction. So that tuition, we've kept it down very, very low in case people wanted to continue on to TC3 for a micro-credential or an associate's degree or whatever. That tuition's about $781. IAED, with the funding that we have raised, covers the first $500, and SUNY is covering that extra $500, and then they're offering that additional incentive for employers for the $500. Now, and if employer has an apprenticeship position, they can get $1,000 if the person is hired for that. So there's many levels of incentives for employers within the SUNY funding, so we're very excited about it.
Fantastic, thank you.
So I feel actions or pictures speak louder than words, and as we had talked about some of our additional hands-on components, these are just some of the pictures of the in-person instruction that we're doing around the dial calipers and micrometers. I try to meet with our manufacturers every year, if not every 6 months, to get feedback of how this program is working for their needs. And one of the things that we heard in late of 2023 was that the virtual reality component was not really preparing people to the level that they were expecting, and people were not retaining the information that they were learning through the VR. They were passing all of the modules, but when it actually came to apply on the job, it was not successful or beneficial. So with that feedback, we had decided that we are going to, our lease is up at the end of this year. It was a 2-year lease with Transfer VR, and that's one of the things we've continued to just build out, is that hands-on in-person instruction. The metrology that we piloted last program was received really, really well. Specifically, Stork, Therm, and Knickerbocker had given the feedback that our individuals needed more experience with precision measurement tools. So with the 24 hours that we've incorporated, that has kind of fulfilled their need. And as I'll talk a little bit later, the spring cohort, everyone got placed into jobs, and they went to Knickerbocker, Stork, and Therm. So yeah, that's just some visuals for the hands-on skills. The on-site field trips we're really excited about for 2024.
Can I just jump in there? So where does that get done? Is that through TC3, the metrology?
I built out the metrology content, and the instructor is contracted through TC3. Mm-hmm. So we're working on the soldering through TC3. They have a soldering lab currently. So their instructor is actually going to be building out the safety component and the hands-on component. But for the metrology, I've had experience building other manufacturing programs that the feedback that we got from the employers and what I could do, I built that out.
You built it out, and that's placed at TC3? Or
yes, the instructor is now trained on it, and he does that as supplemental content on top of the Tooling U that we're doing.
I'm sure it measures up.
Yeah.
So currently, the Direct to Work program is being provided at the TC3 Extension Center downtown. Yeah. And then in the fall, as we build out that the soldering component with TC3, they'll be able to use their labs.
Yeah. Yeah, so that's going to kind of be incorporated as a field trip. We already provide transportation to our 8 manufacturers, so when we do the soldering, it will be over a 2-day period where we'll be bringing them up to the TC3 campus, which will be exciting for
and
them
you need
to
the lab because the
yes,
hoods
the lab.
And stuff
yep,
like that?
The lab and everything's up there. They have special rods, soldering rods, and they have, I think it's about a 20-person lab where they can do 20 people at a time. Oh. I'd like to be up to 20 people someday. So for 2024, another exciting component is that this is the first year all 8 manufacturers signed on for an in-person or an on-site field trip. In 2023, Borg Warner had offered virtual visits where we had several departments where we did the videos and they were open to interviews. Precision Filters also was hesitant at first to do the field trips, but they were always open to interviewing. But this year, our spring cohort, these are some of the pictures. At the top left, Joey, he's actually at Precision Filters looking through a microscope at one of the solderings that they have done. He actually got placed at Stork. He was trained on first shift as a CNC operator, and within the first 30 days, he got a promotion to second shift, and with his shift differential, he's already making over $28 an hour. So just a focus on that. All these individuals in this slide have been placed into full-time jobs. The other four pictures that are kind of on the right-hand side, those are all Knickerbocker, and then the bottom left one is our Lansing Instrument picture. But just to kind of get some visuals of that, these individuals are actually going into these places, and these employers are so invested that they actually get to try a little hands-on while they're doing it. So every year, IAED sets work plan outcomes, and for workforce development, these were our goals to serve 30 trainees, place 26 of them in full-time placements, and maintain a 75% retention. We had the same goals last year, but due to the lack of momentum or not having enough people, we only did 2 of the 3 cohorts that we initially planned, and we definitely did not meet these metrics. But for this year, you know, we did a spring cohort, and we're currently enrolled in our summer cohort, which is in week 2. We are already at 22 trainees. This current cohort right now is probably the most fruitful cohort that we've had to date. We've had 63 people that signed up, 53 people actually attended info sessions, and of those 53, 32 interviewed and started our assessment process. Out of the 32, we had selected 13 individuals for the summer cohort, but we ended up pushing 2 back to the fall because one had travel plans that conflicted with our attendance policy, and the second person, unfortunately, we heard recently had passed away, which was a very unexpected thing. So we currently have 11 individuals in our program, and we have 100% retention as of right now. So this is the biggest cohort. The spring cohort, we served 11 people, but 2 people were 2 direct referrals to Borg Warner, and we accepted 9 people into director work. 1 individual was referred to Law New York to start their certificate of rehabilitation process, as they had some severe felony charges that we wanted to work on before they actually enrolled, because we know we would set them up for failure for job placement. So 8 people actually started the spring cohort, and out of the 8, 6 of those had graduated. We had lost 1 person due to childcare issues, and the other person to transitional housing. They were living in a homeless shelter, and they were taking care of their siblings, and the 9:30 to 3:30 Monday through Friday commitment was too much for them. Both of those individuals that had to drop out are invited to come back at any time to pick up the progress that they need to do to complete the program. So they were not let go from the program, they just are paused for the moment for that.
Sorry, this is totally outside, but the certificate to rehabilitation for felonies, can you touch on that briefly, or what that means, or how that supports a job seeker?
Sure. So New York State is actually changing a lot of their laws, which is really great for individuals that have backgrounds, and there is a process of sealing misdemeanors and felonies. For those that need a certificate of rehabilitation, it's a process to show how are they investing themselves, what is the improvement, how are they creating positive work history, or you know, looking at the patterns or non-patterns of reoffending. So it takes a lot of legal hours. I don't want to misspeak on all of the steps, but it's a support service that this individual was not aware of, and they were very recent out, and like I said, there were several charges that we knew that would be an issue with any background check that they would go to for our employers. He has prior manufacturing experience, but we knew that we would have to work with him on this. So our support is that through our work funding, we can pay for all of the legal hours that this individual will be doing with Law New York to make sure that they get their certificate of rehabilitation.
Amazing. Thank you.
Yep. So in the first cohort, eight of the 9 had been placed into jobs. And by the end of the year, we'll have our retention data. So right now, the full-time placement does not reflect our current cohort that is in here, but I'm pretty positive that if we're already going into week 2 with high retention, I think we'll have some pretty high job placement after this cohort. So now I'm going to transition over to Tompkins Build Pathways to Apprenticeship. And when I came on board to IAED 2 years ago, our focus was first manufacturing and second was construction. And the purpose of this is, once again, to build an inclusive industry partnership for our construction trades, whether it's union and non-union. And this is based off of a 20-year-old initiative that rolled out of San Francisco in 2004, known as City Builds. Across the country, they have 209 Pathways to Apprenticeship programs, and Syracuse replicated that model 3 years ago, and that has been running successfully and serving, I think, 8 of their 14 trades that are at their Building Trades Council. So with all of the economic development activity that's happening across the state, we know Micron's going to be starting in construction in 2025. We have Southworks that is now public and will have a construction phase. And we also know Binghamton with the Clean Tech Hub is also going to have a construction phase. With all of these very large economic development projects, the building trades councils or the trades will not have enough members to actively support all of these projects, as well as our annual projects like Cornell, for example. So the purpose of these build initiatives is to create these inclusive pathways into the trades apprenticeship. The larger initiative of this is the trades are starting to take responsibility that historically they have done a really poor job around diversity and inclusion. So these initiatives prioritize racial diversity, women, and veterans. But really what we're looking to do is serve anyone that's underemployed in this. So that's the purpose of this, and currently right now our trades here at the Tompkins Cortland Building Trades Council, we have 6 that have signed on to be part of this initiative. We have the carpenters, we have the electricians, the iron workers, the sheet metal workers, the plumbers and pipe fitters, and the painters and the painters and allied trades. So those are the 6 that we're going to be starting here. Over time, we hope to serve all 14, but they're the 6 that we're currently doing. So in terms of progress of the initiative, we have raised the funds to create the Pathways to Apprenticeship program. It's a little sticky when you're working with the unions because they cannot actually spend any of their money on non-members. So it is within our responsibility, once again, to build capacity within those trades to be able to pay for any of the instructors that are going to be part of this. Why this is a unique initiative is that we're not having people outside of the trades teach this. This is curriculum that's recognized by the National American Building Trades Union. This is curriculum that the unions are familiar with, which is the multi-craft core curriculum. And the unions will be able to do additional supplemental content in there to really kind of show their hiring halls and their training centers to really prepare people for it. So the other side of this, the non-union side, is number 4, which under our work funding, we are creating another initiative with BOCES, which does not have a name yet, but it is a construction readiness industry partnership. And those individuals that go into that may be at a lower skill level. We're trying to bridge this from the CTE programming, the Careers and Technical Education programming up at TST BOCES. But we wanted to make this inclusive as possible because not everyone's going to be on a pathway to an apprenticeship. So right now, the update with the BOCES is that we have identified a curriculum that we're going to be using, which is the carpenters curriculum, which is Career Connections. They already use it for their CTE programming. So this will be a continuation of that. And we have raised funding for that as well to not only pay instructors, but as well as pay individuals to go through that program, which is really exciting. So now to, once again, transition over to program core components. So we've talked about the initiative, the framework. A lot of the things that we've done in direct work around the recruitment, assessment, referral, prepared, place, and support will be the same framework that we do for Tompkins Builds. A lot of those components are already embedded into the community based off the work that Mary's been doing today and the work that we've been doing in lockstep with Chris and Tompkins County Workforce Development. So the Pathways to Apprenticeship is that program. It is a pre-apprenticeship readiness program that leads directly into unions, and I want to emphasize pre-apprenticeship readiness. This is complementary to what the unions do already because the unions, a lot of them already have a pre-apprenticeship. This is preparing people to understand what it is to go into an apprenticeship. It's to give them the knowledge of what it means to be part of a union, membership dues. It gives them financial literacy empowerment. We do a lot of math remediation in it. We're going to put a few hundred hours of communication and interpersonal skills. These programs tend to be a little bit longer. We're probably going to look at a 10 to a 12-week program as opposed to what our manufacturing program is. Just like BOCES, this will be a paid training, and we're going to offer people $20 an hour to go through this program as well. As I mentioned in the other slide, there is a high level of union participation in this. They are helping me co-design this. We're going to do this in all of the training centers that are of all the trades that are involved, and we're now trying to figure out what are the hand-on components or experiences so we can have people really understand what that trade has to offer if they're going to commit to that union. And as I had mentioned before, this curriculum is it's owned by North America Building Trades Union, and it's recognized by all the unions. So this is not something that we're building on a local level, but it is recognized nationally. So for progress and next steps of this, I have been working with the 6 trades to build out candidate profiles. It's a process that I've done for manufacturing and every other industry partnership that I've built out. And what this will do will help us understand the assessments that we need to embed pre-program and in-program, as well as to make sure that the MC3 curriculum is actually going to be able to have deliverables for people to align to that. And also it will be a tool for Mary to go into the community to work with community partners to understand who that ideal candidate is that will be successful not just in this program but also within the industry as well. So going through this process, I have completed the MC3 certification through NAB2, and Empire State Development, Center State, and SUNY Oswego created an instructional boot camp for people that are coming out of the trades to go through this process as well. People get paid $1,000 to do it, and within that, the MC3 certification is embedded in it. I intentionally did this process as well because I'm not going to refer anyone to it unless I've also gone through it, so I can be a master of knowledge as well. So going through this and working with our trades, I've identified my instructional team for Pathways to Apprenticeship. I'm excited to have a team of 4 instructors, 2 female foremen and 2 males from the pipe fitters and plumbers and the electricians that all work up at Cornell currently. And, excuse me, as I wrap up the candidate profiles, that means the industry side has been done. So what will need to be done in this fall is the community engagement, where now we start working with community partners to figure out that implementation plan. So just down at the bottom are kind of tentative dates for our next steps to now start engaging the community as we're starting to feel the pressure to launch a program in early of 2025. And that is it.
Danny, is there anything that you don't do? Metrology curriculum, multi-craft core curriculum certification. I mean, it's impressive to hear someone who really dives into their work. even when these items are sort of on the periphery of the core of what you do, but you seek out the knowledge to build better programs. So I appreciate that.
Hey, Greg, I also want to just share that one thing that wasn't mentioned in the presentation is that when Danny built out this program, she also embedded wraparound services for all of the participants who go through the program. So what that means is I'm providing intensive case management for all of our participants throughout the program, 30, 60, 90. Basically, I tell these people they're with me for life at this point, to provide support services to make sure that they, you know, if they are struggling on the job or if they're feeling like they need a job coach or anything like that, we are providing services for the long haul. We're not just putting somebody in a job and saying good luck. And that's what I think really sets us apart from other programs is we see people holistically and we are really making systems change one person at a time.
That's fantastic.
Thank you. I would just say, we work with people that have some severe barriers, and very often the systems have let them down, and there is a lack of trust there. I will say I am also a female working in some pretty male-dominant industries, so I need to have credibility, not with just my employers, but I have to establish credibility and trust with the people I'm serving. So that's why I intentionally try to get as much information of the program that we do. So over time, if there are questions or they're going to challenge me on that, I'm able to step in and do the work along with them as well.
Amazing. This is so good. I'll turn it over to my colleagues for questions or comments. Anything?
That was pretty extensive. So.
I had a question for Mary. I heard a little bit about, you know, the outreach that you're doing. Anything that you'd like to share about that or any insights?
Yeah, I mean, there are so many incredible community organizations here that, you know, I've lived here for 13 years now and I didn't even know half of them and the amazing work that's happening here. I think what I love about this program and this job so much is that I get to connect with the people who want to do the good work. Like I get to be able to talk with folks about different opportunities and being able to, you know, really get the point across that you don't have to go to college to have a meaningful life and career. And you can, you know, provide for your family and be proud of what you do. In terms of the work with the community partners, as Danny mentioned earlier, as IAED, we don't provide direct services. So we are working closely with community partners, DSS, and Workforce, of course, being our two priority large partners. But really what I'm doing is I'm working with all of these community partners to say, hey, who are you working with that you think would be a good fit for our program? So what I'm doing is I'm going and doing, you know, presentations to their staff. I'm meeting with people one-on-one. I'm buying so many people coffee just to tell them, like, please call me if you meet anybody who wants a job. And of course, I know that like manufacturing is kind of a niche, you know, career choice, but the biggest thing that we try to sell is first off, like give us a chance, come in with an open mind, but then also we get so invested in these people that ultimately I kind of go rogue and try to get them other jobs sometimes. One story that I'm proud of is we did have someone who went through the program in the spring who ultimately decided they weren't interested in manufacturing about halfway through. And I did say, you know, stick with it because as we said, there's 120 hours of non-technical instruction that's embedded into the program. So that means people are learning about team building, communication skills, how to solve conflicts and solve problems, and you know, really just kind of those skills that employers are looking for. And so they stuck it out, and they ultimately said that they wanted to be a drug and alcohol counselor, which actually was mentioned earlier with KSAC. I was able to get them enrolled into the TC3 micro-credential program, but then also get them a full-time job at one of our newest transitional sobriety housing facilities called Serenity House, and they're making $20 an hour full-time, so I'm really excited about that. So really just being able to develop these relationships, it just creates I guess, a ripple effect of being able to make those connections and be able to, serve as many people in this community as possible.
Well, thank you. That's what I'll say myself, that's what I'm learning more about safer housing, is meeting people where they're at, and one size doesn't fit all. So thank you you can hear it, in everything that you say and everything that you do, that you're really invested in your work and invested in the people in the community. So thank you.
Yeah, I think we need to be careful what we ask for now from IAED, because when we said we want more workforce, I don't know if we were expecting to get this type of focus and this type of product. These are the type of careers that I think at one time were not as niche, right? These are the types of careers that built our country, right? That were generational, that were great paying jobs, that were part of unions, that were, something someone could look forward to and be proud of. And so to create those opportunities for people in our community is really important work. And it may seem like small numbers, right, as the program grows and you develop the foundation and you start from there, but these are having big impacts. And it's definitely transformative, I'm sure, for the participants. And then for our local economy and businesses. And so this is great to hear. Travis?
I definitely would love to set up a time to do a presentation for several of the programs that I work with at GIAC, between HETP, our Young Adults Program, MBK, and the LEAD program. I think there's quite a few people that could be part of these programs, and the staff should be aware of what you all are doing so they could connect and make that happen.
Absolutely, I'll follow up with you. We've been engaging with our HEPT already. We've been engaging with them as well, but I would love to have a follow-up so we can teach everyone about it, do a train the trainer.
All right, cool.
And one last question.
Yeah, have you, maybe I asked you this before, have you been in touch with Maria at Hammerstone? The school, I know they just went nonprofit. And they're downtown now.
Yes, I saw the relocation, and she had just reached out to me a couple months ago.
Oh,
Within
great.
our work funding, we have about $100,000 that we're going to RFP out. And one of the things that in our larger regional conversations that we're having around our construction trades industry partnership is how do you reach more young girls to get them invested in it. So there's an initiative across the state that's called Tiaras and Hammers. And I wanted to engage with her to see if there's anything that we could collaborate on as a readiness component for like summer boot camps or anything for young kids that are kind of out of school for it.
Great, thank you.
All right, well, thanks so much for your time and all the work that you're doing. Keep it up. Thank you.
And it's before 5.
It is before 5.
Did it.
We will go on to any reports from committee members. All right, seeing none, I guess ask for, I always get this wrong. I don't need a motion to adjourn, right?
No, you don't.
Nope. All right, well, I'm going to call us adjourned at 4:51. Have a great day, everybody.